in orthopedics treatment and also in the rehabilitation treatment is very, very important, because it's a special field that we don't take care normally when we do rehabilitation. I will share my presentation, and then I will start the topic today. All right? Okay. The craniofacial system, it is a very, very important part of our body, whom is connected with the rest of the body. Normally, when we talk about craniofacial system, I think it is not clear the correlation between this particular system and the rest of the body, and we believe in our school. Our school is an international school, the NPR International School, that we teach all medical sciences to understand the neuromuscular skeletal diseases with the same concept and with the same protocol of therapy. And I believe that it is very important to understand each other of the disciplines of the medical sciences. It's very important to understand this connection, because some failures in our therapies is because we are not working together. I will go through the presentation now. NPR is myofunctional postural rehabilitation. Is a protocol that I invented many years ago, more than 40 years ago, and now we teach all around the world, in America, Europe and Asia and Middle East. And it is an holistic therapy, just to allow all of us to work together in this particular field, who is the physical rehabilitation. The craniomandibular disorders, normally we make, I think, in my point of view, a very big confusion, because we think that craniofacial system is just TMJs. And as you will see in the presentation, TMJs is part of the craniofacial system. It's not only TMJs. In NPR, it's very important to have a good balance between the craniofacial system and the rest of the body. Very, very important to have a good rehabilitation. We cannot do a big and good rehabilitation if we don't take care in our diagnosis about the mind, the biochemistry and the structure, and into the structure, taking care of the whole body. We will see today the relationship between this particular system and the posture of our body. The dysfunction of the craniomandibular system is generating, in the whole body, is generating a lot of hypo or hyperactivities, and is disturbing some receptors of our posture. I will try to explain in a short time the connection between this system and the rest of the body. TMJs is just one part of the craniofacial system. We have muscles, we have craniosutures, we have teeth, we have the vision, we have the neck. TMJs is just part of this system. We cannot talk about TMJ disorders. It's craniofacial disorders. TMJs obviously is an important joint in this particular system. Why? As you will see during the presentation, when we lose the jaw position, and TMJs is part of the jaw, and the cranium is the connection between cranium and jaw, and lower jaw, And when we lose that position, you will see is starting the problem. It's an important little thing I have to explain to you is that that particular joint resists traction. That's why you can open the mouth, obviously in a limitation, no? But start under disease when is increasing the pressure inside the temporomandibular joint. When we increase the pressure, we will have in that moment we will have a disease, and that's why you will see how the cranial, the central nervous system defend the TMJs. You will see it in the representation, and you will see that particular defense is creating a chaos. When we're talking about the jaw position and craniofacial system, we are talking about the tongue, the teeth, the neck, the hyoid systems, and the trigeminus, and the cervical spine. We are talking about a particular system. It is very limited to talk about TMJs, but obviously all around the world the people talk about TMJ disorders, but it is not TMJ disorder. It is craniofacial dysfunction. When we have a good balance in that systems, it is 100% of possibilities that we will have a good balance in our body. Our body is regulated, but is regulated for the tonic postural system, and a big disturber of this particular tonic postural system is the dysfunction of the craniofacial system. And this is a very important thing we have to understand to have a good physical rehabilitation, and obviously to have a good local rehabilitation. When the craniofacial system is under dysfunction, mainly because the jaw is changing the position, is affecting at the beginning the neck. The different changes of the position affect the upper part of the muscles on the neck or the lower part. Hyoid system is the connection between the upper part of the body and the lower part of the body. When we have a good and balanced mandibular posture, we will have a good functional occlusion that maintain that situation. We have a good balance in the craniofacial system, and nothing happened with the rest of the body. We have different ways how our jaw can change the position. It can change the position laterally, or forward or back. All of them is creating more pressure or different pressure inside the joints, the temporomandibular joint. And the central nervous system know very well that that situation is dangerous for the joint, because can create an alteration of the condyle, the disc, and the whole internal joint. That's why we have inside that particular joint very, very sensitive receptors that when something happens in that position of the jaw, is sending to the brain, to the central nervous system, the alarm saying something has happened there, we have to defend. How? And you will see what is the defense. It's a very bad defense, but obviously it's not the one central nervous system has. Lateral deviation of the jaw is affecting mainly one of the main receptors of the posture, who is the oculomotor system. oculomotor system is very important to have a good posture in our body. And if it's not working well, it will create a bad adaptation in our body, in our posture. And how affect? The lateral changes, unilateral changes of the jaw is affecting unilaterally the receptor. It's creating unilateral hypoconvergence. Hypoconvergence is the convergence of the eyes is very, very important, because when the eyes have a good convergence, they have a good peripheral vision. And when we have a good peripheral vision, our head is straight. If our movement of the eyes is not good, we will adapt the head to one side or to the other side. And it's creating problem in the neck, chronically, and in the posture of the body. We see a clinical case. Look at that. Lateral deviation is affecting one eye's movement. One eye's movement affected by a lateral deviation. And if you can measure the posture, you will see that the posture of the body is overloading laterally. That means that we have a lateral jaw deviation. We will affect the oculomotor system and we will overload our posture. Imagine how you can do a rehabilitation if you don't take care of this diagnosis, if you do not investigate that situation. It is impossible, because you can do rehabilitation and then the system will create some stress to the muscle chains and the treatment will relapse. Second case, look at that. Right lateral deviation, hypoconvergence in one eye. And the body also is changing laterally. It's changing the posture side by side when we have a hypoconvergence unilaterally and when we have a lateral deviation. Another case, we have here a movement of the jaw forward. That means the both condyles are changing the position, and we have a bilaterally hypoconvergence, both eyes. But if you measure that, we don't have a overload laterally. We move the varicenter. We change our posture forward or back, depending if the jaw position is changing back or forward. And how that affect the muscle change? Here is the connection, yoides system. Yoides is attached on the top, insertion to the jaw and to the neck. Lower, okay, is changing that part of our body, and chronically is changing the posture. But when we have a lateral deviation or a forward or retro position, okay, these changes in the mandibular position start the only defense the central nervous system has, that is bruxism. Bruxism, it is a defense, a very, very wrong defense that is creating muscle hyperactivity. Why? Because the brain is saying something is blocking the position, who is the teeth. We have to destroy the teeth to make freedom to the jaw. And this is creating more damage, but it's an automatic defense. It's creating muscle hyperactivity and it's creating chronically a postural alteration. When the pressure is increasing here in the joint, the teeth are blocking that position, and that is dangerous for the joint. And then start the bruxisms. Changes of the jaw position, increase the pressure, alarm signal, bruxisms. From the top, chronically is creating hyperactivity in the rest of the body, and is creating a very, very big postural disease. Bruxisms is a TMJ's defense. Bruxisms is a defense to protect TMJs, but there's a very, very bad defense. Very, very bad defense. Bruxisms is starting a domino effect through the muscle change, and obviously chronically an injury and a postural disease. A common misconception is that bruxism is caused by stress. This is very wrong. The stress, it is not causing bruxisms. It's wrong. Bruxism is not caused by stress, but chronically it causes stress to the body and to the craniofacial system. It's the reverse. Bruxisms cause stress. And how is affecting the jaw position? Affecting the muscle, the cranial muscles. If you see that position, the back position, is the more dangerous position on the changes, because it's making a lot of compression here in the joint, and it's creating hyperactivity in the muscles and in the neck, and it's blocking the neck. That's the beginning. When the jaw is changing the position with this bruxism, it's creating hyperactivity here, and we think that if we treat the muscles and if we treat the neck, that is okay. If you do not annulate that situation, all the treatments will relapse. Look at this. Jaw and the back creating hyperactivity in the whole muscles, and chronically is descending to the rest of the body. It's very important to have a good diagnosis on it. A good diagnosis. The main symptoms of these craniomandibular disorders is headache, dizziness, the loss of the balance, noises inside the ear, cervical pain, diffuse pain, muscle pain, tiredness when waking up, difficulty in sleeping, tingling in the hands, lumbar pain, mandibular click, and a deviation in the opening and closing the jaw. It's common symptoms of the craniofacial system. And obviously we study the posture of the body in our protocol. We do different tests to see what happened in the posture. We measure with the posturometer. We measure the effect of the jaw. This posturometer is measuring the posture of the body and how it's affecting. It's a very helpful instrument based in the concept of Kapanji in the body weight distribution. Many years ago I did the research and I discovered how the little pre-contacts in each teeth is creating alteration in the foot support. It's alteration. It's not the way here to talk about that research, but that's just to tell you that when something happens on the top is affecting the foot support chronically. The pre-contacts in each area is affecting the foot support. And the treatment we propose in our school is, first, annulate that system. If craniofacial system is under dysfunction, we have to annulate the system at the beginning. Annulating the system, we take out the stress into the muscle change, and we can have a good rehabilitation. We call that the programming of the jaw. Many years ago I invented a very nice device. It's a thermoplastic device, more than 12 years ago. We are using that all around the world for all medical sciences. It's a device that any medical science can adapt and then can deprogram the craniofacial system to allow us to have a good rehabilitation. The body equilibrium device, bed, is a very simple device. Obviously, we need a training to adapt it. Is a one measure device that we can adapt on each patient. We can refunctionalize anytime we do a treatment, and in that way we have the craniofacial system annulated. That allows us to have a good physical rehabilitation. It's a single device that any medical science can use to annulate the system. Look at that, this patient with a very big problem, how after use the device, the bed, 4 kilos overloading and the varicenter on the back, and look at after immediately, 0 kilos of overload, centrated. The body is a very nice device to annulate, and is the only nighttime device use it. We teach that in our workshop, and if you want to be in contact with that, this is the company who deal with our courses. I know if you follow us in YouTube and in our pages in Facebook and in the Telegram channel, we have a lot of social, and you can have more information about that. Okay. All right. I hope in a very short time like this, I hope you enjoy the presentation, and if you have any question, I am here